What's up, guys? We're going to go through some mobility work to help out your shin, your foot, your ankle, your knee, that whole basically lower leg, and probably even up into the hip as well. So if you are a runner, if you ever squat, deadlift, lunge, jump, do anything that involves kicking, this is going to help massively with the performance from your tip of the toes up past your knee. And what we're going to be showing specifically is mobilizing up your shin muscle. Physiologically, we call this your tibialis anterior, just meaning the front of the shin muscle. So you'll notice if you find the edge of your shin on the inside, it's bony. We're not really looking at that right now. We're going to the outside of the shin bone where you got this nice juicy muscle here. For a lot of you though, this is not going to be juicy. It's going to be heavily dehydrated. All right. So a couple of things that we're going to do here, guys. One, we want to analyze. This is going to be absolutely excruciating for a lot of you. This is not going to feel good, and you're going to really want to make sure that you're doing this gently and carefully, because this is an area you can't really stretch it. You can't really move it through that much range of motion. We can create a stretch in it using a drill where it involves a belt and tying yourself up a bit. We're not going to go over that right now. What we're going to do, you're going to need one massage therapy ball, and we're going to highlight why it's so important to have a proper massage ball that's made out of rubber. So two things. One, we're just going to take this, we're going to think bottom of the knee all the way down to the top of the ankle, going along the outside of the front of the shin. And all I want to do to start off with, I want to take 1 to 2 minutes to just slowly and gently roll up, roll down, roll side to side, roll diagonal, roll in every direction you can, and really massage out that muscle. 1 to 2 minutes on that, easy peasy. I'm going to recommend for most of you, you want to start off just using your hand to control it. If you're a little bit more loose in the area, then you can go down to the floor or put it up on a chair, and you can put on a lot more body weight with this, but use your best judgment. Remember to follow the 2 basic rules of simple massage work, which is that you go very slowly, and 2, you do not create pain. Stay out of the pain cave. That's one of our rules of mobility. You want to go to the point where at worst it's uncomfortable, right? So rolling around, that's the first thing, 1 to 2 minutes. Then you're going to spend 1 to 2 minutes creating shear between the tissues. So we have this idea where the skin, the sub-Q fat just underneath the skin, the muscles underneath that, the blood vessels and the nerves that run in between all of that, and the connective tissue, and you got the bones and the ligaments and tendons underneath all that, right? All this stuff should be able to slide and glide. This is what we call sliding surfaces in anatomy and physiology. We're going to create some differentiation between those layers, kind of pulling them a little bit. And this is, again, why it's so important to have a rubber ball, because if I put this in place, I'm going to pin it down into the muscle. The ball does not move relative to the skin. It keeps that hold, keeps that grip, because this ball has grip. And I'm going to shear the skin. Maybe you can see on the video how it's actually pulling the skin around, and everything underneath that is staying a little bit more still. So I'm not really massaging out the muscle. I'm creating shear between the layers so that they get rehydrated, so that they can move a lot more effectively. Because the thing, its purpose is to decelerate you every single time your foot goes on the ground. So when I'm running and I land on the ball of my foot, this muscle is contracting to decelerate me as I'm going down, correct? So as I'm doing that, it's undergoing a lot of stress, a lot of tension. So if I'm running, if I'm jumping, that's even more stress and tension coming through that. And you can't really move it around through that much range of motion because your ankle doesn't move that much. It's like trying to stretch your bicep. You would have to dislocate your elbow to effectively stretch it. And that's part of why stretching is useless. We need mobility work that has an actual impact that makes you healthier and stronger and helps to heal injuries, which is cool. So it's a win-win-win scenario. All right. Another thing that we can do here, still working along the same lines as shearing the tissues, is a little drill we call pin, spin, and mobilize. Again, this is why you cannot do this with a lacrosse ball. It will not happen. It will not work with a tennis ball. It could work with no, you need a massage ball for this. Nothing else is going to work because it's going to slide on your skin. So what I'm going to do, take the ball, I'm going to pin it into the muscle, I'm going to spin it, and you can see how the skin starts to spiral because it has that grip to it. So I pin it, I spin it, and then holding that pressure, I'm going to move that around until all that skin has nudged itself out from underneath that. Then I'll go to a different spot, do the same thing. You want to go clockwise and anti-clockwise, just move all over and I would spend about 1 minute doing the first iteration of shearing, and then 1 minute doing pin, spin, and mobilize. You can see how that moves so much of that skin around. That's what you need, because that's less pressure on my circulation, so you get more blood out, you get more oxygen, more nutrients out, and you get the metabolized blood back in so much more effectively, and your nerves work so much more effectively. So there's 2 drills. Play around with it. Make sure you play around with your position so that you're doing it in a way that's not hurting. Don't lay your whole body weight onto your shin and hurt yourself. Cheers, guys. If you suffer with chronic pain, chronic injuries, athletic injuries, I have got you covered. My name is Ethan Hammond, and I am a strength and rehab specialist. I work with people who want to return to sport and fitness, but feel that they can't because of pain and injuries. I've helped people with conditions such as lower back pain, ACL tears, shin splints, neck pain and chronic headaches, and so many more things. Now, a lot of you will be going through things like this, like what I just listed above, and you're saying that you cannot train anymore. Bullshit. You have got to train, and you've got to train right. Train or complain, that is the way this works. Now, I work in person in Southampton, England, but I have online services as well if you're a bit further out. And I also offer free consultations to get you started with a free game plan and strategy for getting out of pain. All you have to do is to send me a text or a WhatsApp message to 07 305 231 339, and I will personally get back to you in the next 24 hours to get you started on the road to proper recovery. If you are serious about leveling up and making real change, this is how you start.